Perfect. Okay, so welcome guys. Welcome to the first year, second semester meeting, semester guidelines. And I hope everyone's had a really good examination period. I think you had biophysics, right? Just biophysics and maybe Czech. I hope that went well. But today we're going to be focusing on what's to come, and hopefully it won't be too daunting. I think you might have some fun and get to learn about what's coming up ahead. And yeah, we'll get started. Just to kind of introduce our team, this is our preclinical team for this year. It's me, Johannes, and Hiroko. If ever you have any questions throughout the semester, feel free to contact any one of us or any one of the MIMSA team members. We'll make sure we can get your answers sorted out. And if you have any questions during this meeting today, please comment into the section, and we'll try and get to as many as we can before the meeting ends. And yeah, so let's just get started straight away. So how do you know if a course has an exam this semester? I think you guys will have seen these letters. I think Hiroko can explain them better than me. So Hiroko, did you want to have a look at explain any of these?
Yeah, so hello guys. So I think that the students should be able to use the information system pretty well, and unfortunately we don't actually have any sort of orientation course on it other than the brief introduction that you get usually before the semester starts. So in case you ever have a question, you're wondering when you look at your courses after you've enrolled for the next semester and you see this new list of courses and you're wondering whether the course has an exam at the end of that current semester or not, you can go ahead and select the course, and next to the number of credits that you receive for the course, there should be either like a 1 or 2 letter designation next to it. Many courses, you've probably noticed, like lectures, just have a Z, which actually just stands for credit, and all that means is that there may or may not be some requirements necessary to fulfill that credit. Sometimes it's like attendance-based, like in seminars, or sometimes there's some homework, like if it's Czech, for example, usually in the autumn semesters, it's just like a credit test and homeworks and things like this. But of the courses that you need to pay attention to would be any which have a K or a ZK next to them. K stands for colloquium, which means that you will have an exam at the end of the semester. However, this kind of course is assessed as pass or fail only. The only thing is that there isn't really any universal definition as to what a colloquium is supposed to be. A lot of the instructors can be pretty creative about colloquiums and can ask for just about anything. So just be aware that it could be anything ranging from an essay, or maybe, for example, in first aid, it's a demonstration of your CPR skills, or for example, it could be an oral or a group project or something like this. And of course, the most important would be any course that has a ZK next to it. ZK stands for zkouška in Czech, which means exam. So this means that you will get a letter grade assessment. So this will affect your grade average if you care about that. And of course, usually these are complex exams. So usually there are multiple parts, like a written part or a theoretical part or some sort of practical part. So that's it from me for this part.
Okay, and also I think it's important to mention that the total amount of credits that you can have for this semester is 45. And I think that's the minimum total that you need in order to pass on to the next semester, I think. So it's important. I think pretty much there's no usual difficulty in obtaining the credits for the upcoming semester onto the next one. So the very first exam, so this is what you'll come up with this semester. Obviously, anatomy and biology will be the big finals, Latin and Czech, and then histology you won't have a final for. That will be the next winter, but you will have some form of credit exams throughout the semester for histology. So it's important to stay on top of that one. Prerequisites, it's important. Essentially what this is these are the exams that you'll need to be passing in order to get onto the next part. So biology is a prerequisite for, I think, also for biochem and physiology. You need to pass the biology practice in order to do those things. And then you need to pass the biology final in order to actually get to do the physiology classes. So I think it's really important. That should be #1 priority, to get biology out the way, because it's a prerequisite for the subjects next year. And Czech, obviously Czech 2 is a prerequisite for Czech 3, the winter semester Czech next year. So get those sorted out, and that should be like the first priority, I think, this summer. If we move on to Czech, I think, can we move on to Czech? Is that okay? Sorry. Yeah, okay. Unfortunately, I know for a fact that it's not going to be everyone's favorite subject, Czech. It's definitely not mine, but it has to be done some way or another. Czech 2, which is the Czech that you guys have this semester. There's 2 progress tests, I believe, and 1 class project. You pass those and you get a certain percentage off. I think it's 2% for the written exam, 3 for the oral, and 3 for the final group project that you guys might be working on. And then, of course, if you do all your homework, that's another 2% off your final mark. Books and materials, obviously, everything's been handed out to you already. The yellow book and the green Czech books are fine. And then a new book that you will need for this semester is Talking Medicine. And this is basically all the Czech that you'll be learning throughout the next few years of Czech in Masaryk. This is what you'll be speaking to with patients in your clinical courses, and I think it's kind of important. I think it's definitely more important than anything in the yellow book and the white book to memorize and to have. I think that most of the exam will be on that as well. And it's important to mention the final examination, guys. It will not just be about this semester. It's about all the content you learn throughout the entirety of first year. So I think that's also important to know. Yeah, we talked about books and materials, study tips for Czech. I know it's annoying, but 15 minutes a day, maybe every couple of days, do a little bit of the vocab, stay on top of the vocab that you have to do for each Czech lesson, get the handouts done, and trust me, I think that does wonders. It does more than you think, I can assure you. But yeah, Czech 2 shouldn't be too much of a problem. Latin, okay. So Latin, the final examination will be a credit test and an oral. It will be that's the same for Czech as well, by the way. And of course, you'll have homework and a presentation project. And I think this can also decrease the pass mark later on. The homeworks, they might be in the form of a weekly robot, and you need at least 60% of the weekly robots to in order to be able to sit the final exam. And the projects, like a 10 to 15-minute presentation, it's not too much of a big deal, and they'll be available on your study materials. You know which books to use. The introduction to Latin and Greek terminology, that'll be your Bible for Latin. The final examination isn't too tough, as like I said, Czech and Latin should be the first things out of your way. And yeah, so that you can move on to the biology and biophysics. Study tips, I think constant revision, like with Czech, just a little bit every day, I think can go a long way with Latin. You can use apps like Cram and Quizlet for both Czech and Latin to learn all the vocab. You know, the more repetitions you have of the vocab, the better for the final examination. But yeah, I will pass it on to Johannes. I think you'll talk about biology.
Right. Okay. So as Ashwin already said, biology should be one of the main objectives this semester. This is because it is a prerequisite for physiology, and not having physiology will put you a year behind. Biology of the previous years was structured a little differently. However, thanks to the COVID situation and the faculty overhauling a lot of curricula at once, you're going to have an entirely new examination schedule and curriculum. But over the previous years, biology never tended to be a significant challenge to most students. The by far most difficult exam in this semester will be anatomy, not biology. So it is important that you stay on top of biology, you do the partial tests, and you prepare for those. But when it comes to the final, as long as you have gone through most of the lectures and studied them in a fair amount of detail, I would be very much surprised if you have any bigger problems with it. So yes, the course is structured like last semester as well, not many changes. You have practices. I think seminars are not a thing for second semester, and lectures. Practices, like last semester, nothing will change. You will have 2 progress tests. You need a total of 24 points on the 2 progress tests in order to get the credit. If that is not the case, you can either take individual progress tests or you can take the credit exam. Again, same as last semester. And yes, the final examination. Now, this is the tricky part. We have to date virtually no information regarding the final exam for biology. Besides the fact that there's going to be a written exam and an oral exam. Over previous years, the written exam had a slight difficulty because, sorry. Yeah, okay, the written exam had a slight difficulty because it had something called negative marking. Negative marking basically means that you have a multiple choice exam where if you can pick multiple correct answers, but if you pick incorrect answers, that will also subtract from your final score. Now, we do not know what it's going to look like this semester. I'm going to warn you ahead of time. The written exam in previous years for biology was not easy. But once the information for that arrives, and I hope it does soon, we can refresh that information on the study hub and the documents that I'm going to send to you. So hopefully that'll do. When it comes to study tips for biology, the core focus should be on the lectures. The lectures cover most of the essential materials that is going to be asked from you during the exam. There are textbooks available, and referencing those textbooks is helpful if you want to dive deep into individual topics that interest you. I get a broad understanding, but essentially the lectures theoretically should cover most of the bits. If you're struggling to understand individual topics, YouTube is probably one of the best resources that you can turn to. Because there's a lot of helpful channels, especially, for example, Crash Course on YouTube, that will explain the fundamental topics that are covered in biology. That should set you quite nicely for the final exam. The next subject, and thankfully this shouldn't be a worry at all this semester. Again, it got a little bit easier thanks to COVID. In previous years, we used to have partial tests unannounced during every single session. That means at the start of the class, you would be called to the front and you'd be asked to sit a small test. It wasn't a big problem, but some people had to go to credit for it. This semester, it's going to be differently. This semester, the only thing you have to worry about is a credit exam at the end of the semester. This credit exam is online. You have unlimited attempts, and it is online for 2 weeks. That basically means you can try it as often as you like, and as long as you hit 90% on any of those attempts, you will have passed histology. So your main priority should be to, yes, go to classes prepared and study those things that I mentioned in classes, but your main priority should still remain on anatomy and biology. For the organization of classes, you have lectures and you have practices. Practices, you need to start drawing, and I'm sure most of you will have been to class this week already. You will have to draw a protocol. And this seems like a tedious exercise for some people maybe, but don't be surprised if during the final exam next year, the teacher might ask you to actually present your protocols. And if your protocols are done in an untidy way, or if they don't illustrate the principles that are covered in class very well, then the examiner might strike a couple of points off your exam. So making sure that your protocols are in order, make sure that you keep them until next year, and that they look reasonably nice and tidy. So that's not going to be a downfall during the final next semester. Other than that, there is not much to worry about for histology this semester. Books and materials. The white book from the faculty is extremely helpful, especially for the first semester. And what I also found extremely helpful for histology is all the online resources that are available. There's histologyguide.org. There is a couple of other websites that I've linked in the study document that we can provide to you. That is one of the most helpful ways of actually practicing online as well, because, for example, on histologyguide.org, you basically have an online slide box, and that and you have an online slide box, and you can select individual topics, look at the slides, find individual features, and that's that. And that should set you up very nicely for histology as well. And with that, I think I am done, and I would hand off to Hiroko for the main object of the semester, and that would be your anatomy.
Okay, guys, hello again. So anatomy, the big shark this semester, I suppose. So organization of anatomy. So you guys this semester should have the lecture with final examination at the end. You should have the seminars, which are going to be held both at CIMU and in the dissection rooms in the anatomy department. And of course, at the end of the semester during weeks 14 and 15, you will have the dissections with the dissections exam at the end of this dissections period. During the semester, you should know already from last semester that you were supposed to have a total of 3 USMLE tests through this year. You will have 2 of those tests this semester. You will have one in week 5 and another one in week 13. So from what my understanding, unless the department chooses to change the content of the tests, my understanding is that the first USMLE test will be focusing on the musculoskeletal system, excluding the head and the internal organs, all of them. And the test in week 13 will also cover the musculoskeletal system, excluding the head and all of the internal organs and any of the neuroanatomy, well, actually all of the neuroanatomy that you've covered at that point. The curriculum for this semester is quite intensive, especially when you compare it to last semester's curriculum. Last semester you covered musculoskeletal system mainly, but this semester with all of the internal organs and with neuroanatomy, you may find yourself for quite a bit of studying this semester. Definitely do not underestimate the amount of material that you have to learn, especially the neuroanatomy can be quite confusing for many students. So definitely take the time to study these materials. Let's see. Okay, so books and materials. I think that it should be made very clear to all of the students that the most essential books, and if no other resources are being used, the most essential books of all are going to be all of the 4 faculty white books. The one for the musculoskeletal system, well, locomotor system, the one that is for spineology and angiology, and there are the 2 nervous system books, which are complements to each other. The first one is going to be the book from Professor Dubovi, which is the central nervous system. And then you have the complement, which is the peripheral nervous system, which was written by some other faculty members. The department also recommends using the green regional anatomy book for topography. However, some students find Mamaryk's anatomy to be more useful in this regard. It's completely up to you, but definitely the 4 white books are the most essential out of all of these books, and make sure that you study from these, if nothing else.
Just really quickly, sorry to interrupt you, Haruka.
Of course.
Guys, if there's one thing that you'd like to take out of this lecture, this meeting, is the fact that these white books are absolutely necessary to know. This is the knowledge that the examiners expect you to know in the final exam. So anything peripheral to this knowledge, it's only for the betterment of your career. But in order to pass this exam, the only knowledge that they require it will be from these white books. So we can't stress enough how important these white books are for passing this exam. So yeah, that's all I wanted to say.
Yeah, so definitely thank you, Ashwin. Writing on that, yeah, definitely. Any other books that you use are pretty much auxiliary, but they're not going to cover the material in the way that the department wants. The reason why we recommend Masaryk for topography, but not necessarily for the other parts of anatomy is because actually, to be quite honest with you, some of the instructors are not, they don't agree with the content in Masaryk. There are some disagreements with, for example, the musculoskeletal system and the organization of Masaryk in general. So it's a little bit difficult, but it's quite helpful for revision because of the structure of the book with the bullet points. It's quite easy to just kind of look at the material at a glance, but definitely the white books, as Ashwin said, once again, I'm emphasizing that those are the absolutely most important books of all in anatomy. So if nothing else, use the white books. Other books that you can use, definitely, you can always use a solid anatomical atlas is always good. You can use whichever one you prefer. Some people prefer Sobota, some people prefer Netters, but it's completely up to you which one you want to use. But definitely you need to be able to visualize these structures. Because these white books, unfortunately, don't really include many illustrations or pictures. The locomotor book has none at all, for example. So it's definitely good to have a good atlas. I personally recommend the theme series, the Color Atlas of Human Anatomy. They're three small little books, and they have some background information and also some illustrations as well. But that's really, again, it's auxiliary. The white books are much more important anyway. So then getting down to the final examination. So similar to biology for you guys, the anatomy examination is also new this year. We didn't have this system before, so we actually don't really know how the system is going to play out. My understanding is at the beginning of last semester, you guys were told that there are basically two ways to pass this course. One of them is through high performance on the USMLE test and on the dissections exams. And the other one is through the normal way, doing it by taking the oral exam. This year, they decided to drop the robot requirement, so there is no written portion for the final examination if you go, if you have to take the final examination. I wanted to quickly talk a little bit about the USMLE deal that was given to some students, because some new information has come out regarding these tests. So previously, my understanding is that students were told that if they scored 6 points or more at the end of the semester and had a dissections grade of C or higher on both of the dissections exams, that they would be able to essentially skip the oral portion of the exam, and they would be given a grade according to the average between the grades in the dissections and the grades from the USMLE tests, or rather the points, the total points earned from the USMLE tests. However, it seems that the department may proactively change these requirements, and because of this, we really recommend that everyone probably try, except unless you're like in the top 10%, really, that most students should be preparing for the final examination, since these requirements might change. Some more details on the way the normal final examination works. So typically, in the past, there used to be a written exam, and then there was an oral exam, and then of course you had to pass dissections as well. But this semester there is no written requirement. It is only the oral exam, and the practical component is determined by your grade in the dissections exam. Normally, or rather, you should draw from a lot of predetermined questions. You'll get like a slip of paper which has 4 questions on them, and you will be covering within these 4 questions the entirety of anatomy in that, well, okay, not in one question, but rather you will have 1 question from the musculoskeletal system, 1 question from the internal organs, 1 question from the nervous system, which includes both a central nervous system component and a peripheral nervous system component. And then the final question should be for topography or regional anatomy. We actually prepared a handout for you guys that we will, I'm not sure if it's already been uploaded, but if not, we will go ahead and link it at the, in this, I'm sorry?
Yes, sorry, it's in the comments section. So if you guys have a look at the meeting chat, you can see that I've linked a PDF right there. That's a handout for you guys that Hiroko made. It's really well made. It's very detailed, and you guys will have all the information you'll need for the next semester to pass the exam. So it has some study tips in there as well. So make sure you use them.
Yes, so thank you. Yeah, so I have an example of how the oral exam question should look in there, so that I'm not going to go over that in detail because you guys can see it for yourselves. But the oral exam is not just these questions from the theoretical anatomy. You will also have to describe 2 to 3 images. I believe that you guys have been going to CIMU, so you guys have been doing like virtual CTs and virtual dissections and things like this. So you should know different types of imaging techniques. You should be able to describe an X-ray or whatever it is that you're looking at. Make sure though, some instructors are quite particular about this. Make sure that when you're describing the part of the body part that you're looking at, that you describe it as the live human body part and not as the bones. Make sure that you say, for example, that this is an X-ray of the wrist and not this is an X-ray of carpal bones, because some of them will consider that incorrect. You also need to be able to tell the examiner if any type of contrast was used in the image, and if so, what kind of contrast was used. So you should know there are only two types of contrast that we care about. It's barium or iodine. And you should know that barium contrast is used only for the gastrointestinal tract, but in the tubes only. So from dissolve any of these hollow organs, but not for like liver or any of these other accessory digestive organs, okay? Only for the tubes. All right, and also iodine is used basically everywhere else if it's used. And then also you should know, like I said before, you should know the special techniques, if there are any special techniques, especially, for example, hysterosalpingography. They love this one. So you should know the name of the techniques as well. All right, and okay, so study tips. So there are actually, I mean, there's more than one way to skin a cat, basically. But what I will say is that there is no fast or easy way to do anatomy. Some people are blessed with an amazing memory and they can remember something after seeing it just once, but that's really not how the average person works. So what we recommend definitely is that you revise, and not just once, but multiple times, to ensure that the material sticks. Also know that having a general understanding of all the concepts is always going to be better than trying to remember all the small details. Because also, if you think about it in terms of time management as well, if you try to focus on memorizing all of the small little details, you may find that a lot more time has passed and you've only learned a very small subset of information rather than being able to cover the entirety of the material and have a more general understanding of anatomy. Definitely, it is extremely advisable to create an organized schedule. It could be daily or weekly or however works, whatever is best for you. But make sure that you try your best to stick to your target goals. Like I said before, don't underestimate the content of anatomy. There is just so much material that if you are not organized, you're going to find yourself completely overwhelmed in the middle of the summer. And obviously, to always keep in mind that if you decide that you're going to put off something until later, to kind of ask yourself realistically, when is later going to be? Because you're going to have to make up that time somehow. If you decide to procrastinate on, especially on some topics that you're not very strong in, that you might find that, for example, when you get to the final exam, that you may have been unlucky enough to draw a question that you may have neglected over your study period. And definitely, I would also recommend that if something is not working, if the way that you are studying, if your time management is not working, to change it up, because your time management is absolutely essential to get through this. Another sort of general tip that I have is to avoid resource overload. There are a lot of materials out there, especially for anatomy, and there are a lot of recommendations, and there are also a lot of people trying to get your money through selling fancy programs and things like this. And ultimately, just try and stick to what works. If you find that a resource is good, stick to it. But of course, we already said earlier that the non-negotiable resources are going to be the white books. And I'm sorry I keep emphasizing it, guys, but really, there is no other way. The white books are your Bible or whatever religious dogma you want to use, but that is what you need to go off of. Some other, maybe some more specific tips. Flashcards can be great. You can either make your own, or Johannes, for example, has some decks for anatomy for Anki that are up in the MIMSA Study Hub. Personally, I recommend Anki because Anki uses spaced repetition. In case you guys are not familiar with what spaced repetition is, it is basically, well, Anki in itself is a flashcard program, which allows you to rate a card based on how well you know the information on the card. And the reason why I recommend spaced repetition over just plain regular paper flashcards is because Anki will do the work for you, and what it will do is it will schedule cards for you. And when you rate the cards based on how well you're able to answer them or not, it is able to pull up the cards that you struggle with more and bring them up more frequently in your schedule so that you don't neglect those cards. Because most people, when they have manual flashcards that they make by hand, they have the tendency to leave cards in the deck, and they don't remove cards that they know really well. They just keep them in the deck. Anki will do this for you. It will remove cards that you know confidently so that you don't see them over and over and over again while neglecting the cards that you don't know very well. So that's why I personally recommend spaced repetition, but of course, it's completely up to you. Some people don't like it, so it's completely up to you. We also recommend for example, being able to draw simple schemes. Some of the examiners may ask to see a scheme. They may ask you to draw something on the examination, but personally, I recommend being able to draw simple schemes, such as the ones that are found in the Spikenology book. I have some examples on the screen now. I recommend being able to draw these simply because you're able to summarize quite a bit of information in a drawing, and you don't have to sit there at the exam thinking about what you forgot. If you're able to draw it, you're able to sort of talk about it. So I think definitely I recommend either whiteboard or, for people who are more tech savvy, if you have tablets or iPads, for example, with an Apple Pencil or some other tool, that's also probably better for the forests, better for the trees.
And sorry, Harika, sorry to interrupt. I just wanted to add, guys, you don't have to be an expert in drawing. Just simple sketches will be enough. Just do it again and again on a whiteboard or an iPad. It takes 10 minutes to repeat, especially these two, every morning or every afternoon or before a class or after a class. Just draw a couple of these diagrams, and I think it will do you wonders, especially in the final examination. The examiners love it if you can draw one of the diagrams that they've placed out into these workbooks. So I think that's a really good one to do.
Thank you, Ashwin. And some other things before we wrap this up, I suppose. Well, we have the MIMSA YouTube channel, which has some recordings of some MIMSA lectures from last semester. So I definitely recommend you check those out if you haven't already. But we will have a few new lectures this semester, which will be based on topics that haven't been covered yet. And one last thing, I suppose, in case you're looking for some study tips for the USMLE tests. There are some resources online that you can find for USMLE type question banks. I haven't seen any personally that are good, that are free, but I did see yesterday, I believe, that Lecturio is actually offering a free anatomy question bank with hundreds of questions. I believe you have to sign up for it, and I'm not sure what that means. It might mean that you might receive a lot of promotional emails, but my understanding is that the question bank is free. So if you're looking for some USMLE style anatomy questions, I would definitely, I would check it out. I guess you have nothing really much to lose. But for students who may have some paid resources like AMBOSS or something like this, there are also some question banks in there as well for USMLE style questions. And so then now I have a question to pose to you guys. How do you guys think that we can change, we as MIMSA, how we can change these seminars to improve their usefulness? And of course, this is the end of our presentation. If there are any questions, otherwise, thank you guys for your attention and thank you for attending.
And yeah, final, just a bit, sorry, Johannes, you go ahead.
I'd just like to add on to your point about revision, what type of revision you use. No matter which type of revision you use, whether it's flashcards or drawing or writing things down in order, I know there's pandemic times and theoretically we're not allowed to meet, but it is, at least I've personally found it extremely helpful to have at least one person to study with. Because, you can check your knowledge yourself and you can check yourself whether you remember a flashcard or not. But that doesn't replace having somebody else who studies a different way from you, who studies different materials from you, check your knowledge. And that might be uncomfortable because that person might be asking you questions that you do not know the answer to. But this is a crucial way of figuring out that the revision, whether the revision that you're doing is actually having an effect, whether you're making the right effort, whether you're studying the right things, whether you're studying the right details. So find a person that you're comfortable studying with, who studies to a similar level as you, who you think is as capable as you, and study together, ask each other questions, work through materials with that person, because it just, knowing the stuff for the anatomy exam is good, but you need to be able to communicate that to your examiner as well. And that only comes with practice. So I'd highly recommend that.
And one final thing from me. I found that the mantra with medical school is repetition, repetition, repetition. The more times you can repeat something, the more times you can go through it in your head without looking at any kind of information in front of you. I think that's how to best prepare for these exams, because a lot of it's just memorization. A lot of it's just raw, dry facts. And it's not stuff that we have to wrap our heads around and, difficult concepts that we have to understand. Not majority of medical school isn't like that, especially anatomy, where you have a lot of, like, for example, muscles. Like, it's only simple, like you only need to learn the function, innervation, insertion and origin, and it can be daunting sometimes. But the key is repetition, as you guys know. And I think the best advice I can give from my part is repeating the first semester's syllabus as you're doing the second semester syllabus. So I believe you guys had GIT this week. I'm not sure. And next week you have something else. I'll make sure that we have the right syllabus so that we can best prepare for you guys. We have a Facebook group, by the way. I linked it into the comment section. Please follow that. Okay, next week, respiratory. Thank you, Alexandra. Yeah, so that Facebook group, please follow the Facebook group. The previous MIMSA team created that Facebook group, and they post every week, they post relevant information. And so you guys had GIT this week. That's great. We did a GIT lecture last summer semester. I think it was Stephen Paul that did it. So we have a bunch of amazing lecturers that do these, a bunch of seniors. They can add their own perspective onto it, and Hart next week as well. Okay, no, that's good. Yeah, so we have some content for you guys. We have a bunch of, I think it's really important for you guys to attend the MIMSA lectures that we do throughout the semester, because when I was a student, it was really helpful for me to attend these MIMSA lectures. And when someone is telling you this information, it's more likely to stay in your head. Like with what Johannes was saying, when you're studying with someone, the information, they can say it in a way that it will stay in your head that you wouldn't have thought of. And when you're reading it from a piece of paper, sometimes it doesn't stick in your head. So, and going back to the point that I was making before, stay on top of the syllabus this semester, and maybe in the weekend revise whatever you did last semester, especially muscles, bones and stuff like that, because that's the first thing that you did, and so that's most likely the first thing you're going to forget. And it's also the first question, so in the examination, in the oral exam. So you've got to be best prepared for that. And and YouTube videos, definitely YouTube videos. I can't recommend this enough. I don't know about Hiroka and Johannes, but I used YouTube videos more than I used the atlases. The atlases are great, but the YouTube videos, if there's someone for you to guide around pictures and videos and like the whole human body, it's like, for example, Anatomy Zone. I can't recommend it enough, especially for vessels. It was perfect for me. I was able to visualize his videos during my examination. It was perfect. Amanda Hussein, Dr. Najib, I think you guys would have heard of him already. He's perfect for anatomy. And also Sam Webster, I think he does really good videos on internal organs with anatomy. But yeah, I think that's it from me. If you guys don't have any questions, I think we're ready to wrap up. I've plugged the Facebook group. You guys definitely join that. We'll link our MIMSA lectures onto there as well. And all our MIMSA lectures will be in according to your syllabus. So yeah, GIT this week, that's great. We did a GIT lecture last year. We'll re-upload that onto the Facebook group. And we have multiple lectures planned for the rest of the semester, so be sure to join. And okay, no, that's fine. Okay, so yeah, good luck, guys. I think you're going to do well.
Actually, there's one more thing that I forgot to mention. I'm sorry, guys.
Sure, go ahead. No, that's okay.
So we mentioned that the prerequisites for next semester, that the exams that you need to really pass this semester in order to be able to stay on track are going to be biology, and then of course Czech to some extent as well. But we didn't mention anything about anatomy, and this is because anatomy is actually not a prerequisite for courses in second year. However, definitely try to pass the exam this summer, because when you fall behind, or in the winter even, but when you fall behind, when you end up as an anatomy repeat, that really greatly complicates your chances of staying on track. So definitely try to pass anatomy. Just try as much as you can, to stay organized, to stay on top of anatomy, and to pass it this summer, or at the latest this winter.
Yeah, that's definitely true. Yeah, I got a quick question. Daniel asks, I've got a quick question about medical ethics because I don't really understand how we will get our credit for that. To be honest with you, Daniel, we don't really understand. We thought until a couple of days ago, I thought medical ethics was a course that we had in fourth year. I had medical ethics not too long ago. I had it last semester, so I was a little bit surprised to see that medical ethics was popping up for first year. Hiroka, do you know anything about that? I think you did a little bit of. We don't know too much, like I said. But yeah, we'll get back to you. We'll definitely update you on that.
By any chance, do you know who your teacher is for medical ethics?
But if not, it's not too bad. It's too cool. I think that's the same one we had.
Yeah, I don't exactly know how it works for the international students, and I'm really sorry that I don't have information specifically for your course. But I do know that for the Czech students that they are having some sort of group colloquium. 1 second.
While she's checking on medical ethics, one final thing from me, guys, is that I know it seems like a lot. There's a lot of these courses here, especially with Czech and Latin out the way. I think you'll feel a lot better in June when you have just biology and anatomy to do. But the thing is, the most important thing to remember is get the smaller exams out the way, because maybe 15 minutes you neglect in order to not do vocab or do a certain declension in Latin, or muck up an exam here and there, or like not do enough homework to get that percentage off. That small percentage might make a difference in when you schedule your anatomy exam later on in June, and can have a ripple effect. And like Hiroka was saying earlier, the main reason you want to get anatomy done this summer is because it can have like almost the lasting effect that it has. It never really ends. A lot of my friends, they had the problem, and it started with anatomy. I think if you get anatomy out the way, you're almost guaranteed to not get kicked out ever from this university. I think the others will agree, if they have anything to add about this. But yeah, that's all from me. Did Hiroka, you had anything?
Yeah, I'm back. Yeah, so my understanding is that for medical ethics, that you should have been given some sort of date in April in which you will be given an essay topic at a certain time. I'm sorry, I don't know the details so clearly, so I'm just trying to relay it the best that I can. So you will be given an essay topic, and you will have 1 hour and 15 minutes to write that essay and to submit it online. I suppose it's online. So once after this essay submitted, then you will have a group colloquium date in which you will get together with a group of people and you will discuss your essays, and that will be your examination.
Right. Okay. That doesn't seem too hard. It's actually an interesting subject as well. I'm kind of jealous that they get to have it quite early. Get you really involved with medicine. But yeah, that's it from us, guys. Thank you for showing up. I'm really happy with this turnout. I know we could have, if we did it in person, that we could have answered a few more questions. I guess you would have been able to. We could have shown you a lot more, and you could have asked us maybe. But yeah, thank you for coming, and good luck for the semester. Please don't hesitate to contact any one of us. We'll do our best to answer any of your questions. So yeah, thanks, guys.
Thank you so much.
No problem. Stop the recording.